Congestive heart failure, CHF, is a serious condition in which the heart can't pump blood effectively, leading to a buildup of fluid in the body known as edema. Common symptoms of CHF include shortness of breath, fatigue, and swollen legs or ankles as a result of excess fluid accumulation. Edema itself can present as puffiness or swelling in various body parts, often caused by standing or walking for long periods. Treatments for CHF can range from lifestyle changes and medications to advanced therapies such as surgery or mechanical support devices, and managing edema usually involves addressing its underlying cause, which in this case is the compromised heart function. Risk factors for CHF include high blood pressure, coronary artery disease, and diabetes, which all can contribute to the weakening of the heart muscle. Here's a detailed look at the multifaceted aspects of congestive heart failure and edema and their interrelated impacts on health. Affected organ systems, cardiac versus generalized. Congestive heart failure, CF, often presents with symptoms localized to the cardiac system, notably fatigue, shortness of breath, and irregular heartbeat. However, it can also cause systemic effects like edema, particularly in lower extremities, due to the heart's reduced ability to pump blood effectively, leading to fluid accumulation. By contrast, generalized edema might result from a range of conditions, not solely cardiac in origin, including renal failure, liver disease, or nutritional deficiencies, reflecting alterations in fluid homeostasis. Distinguishing CF-induced edema from other types requires careful assessment of additional symptoms, medical history, and diagnostic tests targeting specific organ function to pinpoint the underlying pathology and direct appropriate treatment. Underlying etiology, heart dysfunction versus fluid imbalance. Congestive heart failure, CHF, and edema are intricately linked, yet their causative mechanisms differ. CHF, primarily a problem of cardiac function, leads to poor blood pump efficiency, which in turn can cause fluid to accumulate in tissues, a condition known as edema. This specific type of edema related to CHF is often characterized by fluid overload, predominantly in the lungs, pulmonary edema, and lower extremities. Conversely, generalized edema might arise from a variety of non-cardiac etiologies, such as kidney or liver disease, where the underlying pathology is a derangement in fluid balance and distribution due to the compromised function of these organs. While both conditions can present with swelling and shortness of breath, the therapeutic approaches differ significantly, underscoring the importance of correct diagnosis. In CHF, management includes improving cardiac function and reducing fluid overload with medications like diuretics, whereas in edema from other etiologies, treatment targets the underlying organ dysfunction. Symptom onset, progressive versus rapid or localized. In differentiating congestive heart failure from edema of other causes, the pace and distribution of symptom onset offer critical clues. CHF-related edema tends to be progressive, reflecting the gradual worsening of cardiac function, and typically presents with bilateral and symmetrical swelling, mainly in the lower extremities due to its reliance on gravity and body fluid dynamics. In contrast, rapid onset edema is more indicative of an acute event such as a clot or infection, and might affect one limb or part of the body, signaling a localized issue. Observing the progression and localization of edema, therefore, aids in ruling out or considering CHF among the differential diagnoses. Primary manifestations, systemic circulatory versus tissue-specific. Congestive heart failure, CHF, often presents with systemic circulatory overload, leading to pulmonary congestion and peripheral edema as the heart struggles to pump blood effectively. In contrast, edema can be tissue-specific, resulting from local inflammation, venous obstruction, or lymphatic dysfunction, independent of heart performance. Distinguishing between these two conditions is critical because CHF requires targeted cardiac therapies, like diuretics and ACE inhibitors, to reduce cardiac workload and prevent further deterioration. Alternatively, tissue-specific edema is treated by addressing the underlying cause, such as with anti-inflammatory drugs for local inflammation or compression therapy for venous insufficiency, instead of focusing on cardiac function. Treatment focus: cardiovascular support versus fluid management. In congestive heart failure, CHF, the heart's diminished capacity to pump blood necessitates cardiovascular support, including medications like ACE inhibitors, beta blockers, and diuretics, to improve heart function and reduce the workload on the heart. Additionally, lifestyle changes and possibly devices or surgery are recommended to manage symptoms and slow disease progression. Conversely, when treating edema, particularly when it's not predominantly driven by heart failure, fluid management is key. Treatment targets fluid accumulation and involves diuretics, a reduced sodium diet, and addressing the underlying cause, such as liver or kidney disease. It's important for healthcare providers to differentiate between the two conditions, as the primary concern in edema is the regulation of fluid balance, whereas in CHF, the emphasis extends to enhancing and supporting the heart's pumping ability.